It is our pleasure to introduce Dr. Rick Bernstein to the community. He's a vascular surgeon, has many, many years of experiences. Matter of fact, he just finished his second or third fellowship at the Cleveland Clinic. We are delighted to have him here in the community as a vascular surgeon. There's a whole host of procedures that he wants to introduce to the community. And in fact, a little bit later on here this morning, we're going to be introducing him to all the referring physicians in primary care in the community. So I couldn't be more pleased to make the announcements for Dr. Bernstein to be here, and we thank you.
Thank you very much.
Thank you.
Appreciate that.
All
Thank
right.
you. Well, I've been doing vascular and thoracic surgery for more than 20 years now. I'm originally from Chicago, but we've been in Las Vegas since 2003. And vascular surgery, as many people know, but some don't, has to do with treating the circulation, including the arteries and the veins of various parts in the body. And most of what we do now has to do with bypassing blockages in arteries or removing veins or treating veins from the inside. That portion of our practice where we treat things from the inside has now gone to arterial treatments also. So we're doing less things maximally invasive and more things minimally invasive now. That's why I just came back from this special fellowship at the Cleveland Clinic, which was strictly about endovascular surgery. So instead of having to make great big long incisions, which occasionally we still have to do, but less and less with these long incisions on people, sometimes we don't need to make incisions at all. We can treat even things like abdominal aneurysms and thoracic aneurysms through little small incisions in the groins and put stents in from the inside. And these are treatments that used to be relegated to other specialties like radiology or cardiology. And surgeons were relegated to taking care of complications. But now the surgeons have gotten trained, and that's why I went to Cleveland Clinic, so we can all do the same thing. So we can now not only do the surgery, but I can also do the interventions, the less invasive procedures, and be complementary to the cardiologists and the radiologists to help them and back up their practice and work with them. So in that way we can treat a whole cadre of patients that we couldn't before.